Hi, this is Connie Haxby, licensed clinical social worker, and today's video we're going to talk about something called distorted thinking. And basically what distorted thinking is it's looking at things that happen in our life in such a way that maybe are negative or untrue, and we really need to question the way that we're thinking about that thing and try to validate it. Is it true? Question it. Is it not true? What proof do I have? What's the probability that this is actually what's going on? A couple of examples of distorted thinking would be catastrophizing. So, thinking of the worst case scenario in a situation. So, let's say someone is going to meet you out for dinner and they're running late. Maybe the first thing that you think of is that they've been in a horrible car accident. That would be catastrophizing, thinking of the worst possible case scenario and then letting that feed into your anxiety. Another example of distorted thinking would be black and white thinking. And this is where we get into things such as, seeing things as good or bad, all or nothing. If I do something that is against my moral value, then I'm automatically a bad person. I can't have any good. I'm completely bad. It's horrible, that kind of thing. So, black and white thinking, when we think of things in terms of all or nothing or good and bad, it really doesn't leave any room for that gray area to look at things that we choose behavioral wise and say, you know what, I can make mistakes and still be a good person. I can, maybe not choose the best course of action, but still be a smart person. I can make bad decisions and still forgive myself for that and still be a good person. I can maybe not do well on that exam, but that doesn't mean that I am completely dumb or not smart. I can still be intelligent, but maybe just have had a bad day for that particular exam or test or whatever the case may be. Another example of distorted thinking would be personalizing. So let's say I'm at work and I'm walking down the hallway and I pass Bob and I say, "Hey, morning, Bob." And Bob just shoots right past me and doesn't say anything. I might look at that and take it personally and think to myself, oh my gosh, what did I do? I must have really ticked Bob off at some point, or, he must not like me. Maybe I'm not his cup of tea, but oh my gosh, I really bothers me when people don't like me. And maybe Bob was just having a bad day. Maybe Bob had some bad news that he came into recently, or maybe he's just, in kind of a funk. So that would be an example of personalizing something that maybe has nothing to do with you at all. And then the last example that I want to use is jumping to conclusions. And that's when we take a situation and we say, okay, so, I texted my best friend earlier today about getting together for dinner this weekend, and she hasn't gotten back to me yet. So that must mean that she is ignoring me. That must mean that she is mad at me. She's giving me the cold shoulder because I ticked her off in the last conversation that we had, or the last time that we got together. And so that's really taking a situation and just sort of, mind reading. Another example of distorted thinking, thinking that you know exactly what's going on with someone, mind reading, jumping to conclusions, thinking that you know what's going on with that person, when really what you're doing is just you're doing a lot of speculation and you don't know. So what you want to do with distorted thinking is you want to take a step back and you want to go, okay, is it possible that there's something else going on? Is Bob possibly having a bad day? I know that Bob was up for a promotion. Maybe he found out he didn't get it. Somebody's late for dinner. Maybe there's someone who tends to be late. So I'm not going to jump to conclusions or catastrophize and think that it's the worst case scenario. I'm going to give it 15 minutes, maybe shoot them a text or maybe call them and say, hey, what's going on? Just want to make sure that you're okay. So not allowing your mind to go to those places where it causes angst or anxiety, because a lot of times that's what happens when we feed into anxiety or negative thinking thinking or pessimism is we're looking at things in such a way that it's just not good for our psyche. It's not good for our well-being. And we really want to be able to validate those feelings and validate, or I guess invalidate really, those thoughts and see if what we're thinking is actually true. So as you'll see, with all of the videos that I do, so many of the things that I talk about kind of tie in together. So when we're talking about distorted thinking, if you've, watched the video on cognitive behavioral therapy or reframing negative thoughts, that's exactly what we're doing with distorted thinking too, is we're recognizing that there's some distorted thoughts going on. We're questioning those thoughts. We're trying to figure out, okay, is this a true thought? What's the probability that this is a true thing and that it's not just my mind taking over? So you really want to make sure that you're, again, just making sure that your thoughts are where they need to be and that you're not going overboard and causing some anguish that doesn't really need to happen. So with distorted thinking, again, just taking that step back. Is this true? What's the probability? Am I jumping to conclusions? Am I using distorted thinking? And then question it and then kind of go on with the day and see if that's something that helps with your mood, because it really should. There was this great quote by Mark Twain, and I'm not going to get it verbatim, but something along the lines of, I've survived a lot of really horrible things in my life, some of which actually happened. And so, what he was saying with that quote is, we conjure up all of these anxieties in our mind and all of these horrible things. And either A, they were never a thing to worry about in the first place, or they never came to fruition. So it really does us no good. There's no benefit that we get from worrying about things that aren't actually there. So keep that in mind when you're thinking about all of these, horrible things that may be going on that aren't true. Once again, I always need to remind folks that these videos are for informational purposes only. They are not used to treat or diagnose any kind of mental illness. If you are concerned about mental illness, please talk to your healthcare provider and they can guide you in the right direction for getting treatment. Until next time, have a great day.